Lassa fever is an acute and often viral disease that was first discovered in Nigeria in 1969 in Lassa, a village in Borno State. At that time, it was subdued, but it has occurred from time to time over the past decades. The latest outbreak began last August. So far, 212 suspected cases have been reported in 62 local government areas in 17 states. Professor Isaac Odewale is the Minister of Health. He says the outbreak is a national embarrassment that must be tackled urgently.
We can manage embarrassment, but when we allow another outbreak to occur August 2016, it will become a national shame for all of us. And so one of the things we must do is to prevent us dragging this nation into shame. And the only way to do that is to stamp out Lassa fever.
Dr. Osage Ehanire is the Minister of State for Health. He says health officials have to find a lasting solution to the epidemic.
The specific objectives of this emergency council meeting are to facilitate discussions on control of the ongoing Lassa fever outbreak. Secondly, to develop strategies for prevention and management of outbreaks in Nigeria.
Commissioners from the 17 affected states say surveillance teams have been set up to curtail further occurrence. Dr. Cecilia Ojabo is the Benue State Commissioner of Health and Human Services, while Dr. Jaff Momo is the Director, Clinical Service, National Hospital, Abuja. They say more needs to be done to educate the public about the disease.
If we avoid being in contact with the rodents, we cannot eradicate all the rodents in the bush. But if it's a delicacy, as it is in my state, we can look for other delicacies for now to avoid getting the virus through the rodents.
I want to appeal to the commissioners of health that when you go back, part of the jingles and part of the message you should send across is that patients should be referred as quickly as possible.
A Lassa Fever Action Committee headed by Professor Oyewale Omotori, the president of the Nigeria Academy of Science, has been set up to take charge of the campaign to get rid of Lassa fever. The health officials say they will meet again in March in Sokoto to get an update on the campaign. In Abuja, Sama Mudedan, GoTel News.